What are dermal fillers? Are they this mysterious substance that are going to overfill and give you a round pillow face? Are they something that you can only find on the moon? Where are they from? What do they do? Well, I'm really looking forward to discussing dermal filler with you and going through some of those questions that many of my patients and yourselves are curious and wonder about, as well as ask me when they come into clinic. So what we'll do now, we'll go through a number of points on dermal filler, and I'll try and answer most of those questions that many of my patients ask me. So when discussing dermal fillers, let's go right back to the basics. As you can see here, we start with the skin. Now, this is the largest organ in the body, and it's one that is neglected. Dermal filler can be used for the skin. We have some great treatments that can help really tighten the skin, so improve the elasticity, as well as hydrate the skin to provide that lovely glow. Remember, everything we do underneath the skin, if we haven't got that glow, we're not achieving those best results for you. So it's really important to achieve the best skincare and quality that we can. So underneath the skin, one of the most important parts of the facial anatomy are these fat pads, and as you can see up here, we've got lots of different pockets of fat. So if you imagine fat cells in a little bag or a container, what happens is they shrink over time. So when we're younger and more youthful, those fat pads are holding our skin up in place. But as we age, they start to shrink down. And so what happens is the skin isn't held up where it was. And as the skin starts to sag, we start getting these lines here, these marionette lines, the jowly area, our jawline becomes less defined. We start losing the contour around the cheeks and at the front of the cheek, as well as find that we have the appearance of the tear trough. This happens all over the face. We may find that our temples are starting to look gaunt, and as we lose the fat in the temple area, the skin starts to move forward, so we start getting the skin over the upper eyelid. Many patients suffer from that. We also find we become more flatter along the forehead, and there may be a cavity here. With a fuller forehead, the brows are at a good place. However, when we lose fat along the forehead, there's nothing holding that brow up and it starts to move down. So that's another place we could think about treating. Underneath the fat pads, right down to the base of the face, we have the skull. Now, what happens is as we age, the skull starts to reabsorb itself. So we get flattening across the cheek area, which again provides less support to that skin. So again, the skin starts to sag downwards, causing that nasolabial line, the marionette line, the downturn corners. It also causes the tear trough area due to the flattening here. What's very interesting is as we age, if I turn my head to the side, the jaw actually shrinks, so the chin moves backwards. So if you imagine the cheek gets flatter, so the skin starts to sag down, and then the chin moves back, and so the skin isn't being held taut as it once was. So we need to consider all of these areas and layers to the face when treating you, our patient. So what is dermal filler? Dermal filler is a replica or man-made version of collagen. So the collagen that we have in our face is so pure that we produce it and metabolize it within around 24 hours. Now, what the companies have done is created a man-made version of this. So they've taken the molecule of collagen, hyaluronic acid, and they've joined them up lots together in rows or chains. Now, what that means is these products last for a lot longer than 24 hours. So the products that we use, the Juvederm Vicross range, which you can see here, they tend to last for 12 months, 18 months, 24 months, and even up to 2.5 years, depending which product we use. What does dermal filler feel like? I have loads of patients that come in and say, I'm worried about dermal filler because is it silicone? The best one is it concrete? Well, I can assure you it's not concrete. And I've actually got some here. So here's some dermal filler we made earlier. So as you can see, it has a gel-like appearance. I can promise you, it's definitely not concrete. It's very, very soft. Great, so now you've seen what dermal filler looks like. It's a very soft gel-like substance, and the great thing about these products that we use here is they integrate within the skin so naturally. So you'll get your final result 4 to 8 weeks later, and it's a really subtle, natural result. And that's something that we specialize in here at Time Clinic, and that's our patients go away and their friends and family say to them, "Oh, have you been on holiday? You look really well." And those are the results that we really love achieving. When do we use dermal filler? So many patients come in to see us and they're worried that when they look in the mirror, they feel as though they look tired. They look saggy, angry or sad. Or some patients would like more contouring, would like to look more masculine or feminine, even contoured. And so these are some of the times when we can use dermal filler. Another one is for beautification. So every single patient that comes in is very individual and very different. And what's really important is to take our time to really understand you, what you're looking for, the results you're looking to achieve, but also that emotional look that you're trying to either improve or achieve. Because as we know, these treatments are much more deeper than just the skin. Some of the other reasons why we use dermal filler would be for lines, wrinkles, folds, to lift. That's a very, very common one. Also to start defining, so the definition of the jawline is a really popular treatment at the moment. Contouring the cheeks, so if you've ever used makeup to contour with the light and the dark shadows, we can do that for you and you don't need to remove it in the evening. Lip augmentation is a very common treatment, and the way we like to treat our patients is in a very subtle and rejuvenating way. So when patients smile, you may find that your upper lip turns inwards and becomes very, very thin, and that's a very common condition that we treat. Another treatment is for vertical lip lines, so-called smokers or lipstick lines, and that's another common concern that some of our patients have. The jowly area, again, using dermal filler to lift up, to stretch that skin and to help reduce those jowls. Many patients come in to create symmetry to their features, and one of the things I do explain is that pretty much none of us are fully symmetrical. However, we do have some patients that have a very obvious asymmetry for numerous reasons. So using dermal filler to create symmetry can really, really help those patients, their confidence, for example. One of the most common areas to treat patients are the cheeks. And one thing I really like to do is use dermal filler along this area to really lift up that skin, to help with these lines, these nasolabial lines, to help with the marionette lines, the corner of the mouth, the jowl area, and also the jawline. An area that I commonly treat is the chin. And it's one area that patients don't normally think about treating. And there's a number of reasons I do treat this area. The first one is to create a heart-shaped feminine jawline. I can also create a masculine jawline for some of the patients that we have that want a masculinization. Other reasons to treat the chin are, many of you may feel as though you have the jowl area here or an undefined jawline. So what I can do is stretch the chin forward in an anatomically correct way, as well as lifting with dermal filler here to create a much more tighter jawline. Have any of you ever wondered about having a non-surgical nose job, or have a bump in the nose, a downturned nose, or an asymmetrical nose? Many of our patients do, and we really can use dermal filler to treat those patients as an alternative to surgery. And a lot of people like that because it's a very quick treatment, it is non-permanent, and affordability does come into play. Great things are there's no downtime, so many of our patients go straight back to work, as well as the reduced side effects. So with dermal filler, I could smooth over the nose, I can lift up, creating a feminine nose, I can also narrow from here, as well as creating a more straighter and contoured appearance to the nose. The risks are really important to discuss, and I believe my patients should have all the information. So if you're undergoing any treatment, it's very important for you to know the positives and the negatives of those treatments. So it's something I'll just run through very quickly. So some of the risks of dermal filler include bleeding, bruising, infection, redness, soreness, asymmetry, lumpiness, again very rare. Some of the even rarer risks are if a filler were to compress or block a blood vessel. This may reduce the amount of oxygen to the surface of the skin. So I always say to my patients, if there's some purple discoloration or dark discoloration, if it's very painful, if you're worried at all, just give us a call, because we may need to bring you straight into clinic to examine you, make sure there's nothing going on there. And if there is something, we can always correct that. The very, very rare risks of dermal filler, and I'm talking maybe 200 cases in the world ever, and this is us doing 8 million cases every single year worldwide, so you can see what a small number this is. However, very rarely filler may make its way into a blood vessel, go to the back of the eye, causing visual disturbance or blindness. Now again, this is extremely rare. So you may have come across a term called the facial overfilled syndrome. Now, what this is when patients have had too much treatment and they start looking artificial, and it's quite obvious that too much treatment has been done. So something that we like to focus on here at Time Clinic is a very subtle result where patients look like themselves, just the best version. Some of the causes of this are just having too much treatment, and we believe something that's very important is the practitioner to say no to patients. We've reached the upper limit of our treatment now, and that's something again that we do here very freely. We are more than happy to say no to patients when it's the right time. So we love treating our patients, we love treating you, but when it comes to a time that we've reached our optimal result, then it's time that we'll say, let's pause here and let's review every 6 to 12 months. And then if we need another treatment, we can do that. Because what we really look to do is to create beauty for our patients. And what we believe is if we overfill or overtreat patients, then we can be taking away some of that beauty. So it's very important to know when to stop, and that's something that we are happy to tell our patients. Many of you may wonder whether dermal fillers can be used in combination with other treatments, and the answer is yes, absolutely. I do many treatments using dermal filler and combine it with other treatments here in clinic. So here at Time Clinic, we'll spend a good 45 minutes with you, really trying to understand you, what you're looking for, as well as examining you and showing you what's happening, what's causing those, let's say that line there. So we'll go through all of your concerns and go through what's causing them and show you how together we can come up with a treatment plan, and again together create the best patient experience. If you'd like to know more about dermal filler, please give us a call, DM us on Instagram, TikTok or Facebook. Our handle is @timeclinicofficial. Our website is www.time-clinic.com, or please give us a call. Here are our details here that you can see, and we'd be more than happy to talk to you and get you in for your own bespoke consultation. Thank you so much for watching. I look forward to seeing you next time when we'll talk about fine lines, wrinkles and treatment with botulinum toxin.